Are you at high risk of getting skin cancer? How often do you get a full body scan to check for melanoma? The question of who should be getting full body scans and how often is controversial with no national consensus. But a new piece in the journal Melanoma Management calls for new guidelines. And joining us now to discuss is WSJ health reporter Sumathi Reddy and Dr. Jennifer Stein, associate professor at NYU Langone Medical Center's Ronald Perlman Department of Dermatology. Welcome, ladies. Thanks to both of you for joining me. Sumathi, so this week, the journal published an article that was penned by 50 dermatologists. What are their new recommendations?
Okay, so this is a group of skin cancer experts and dermatologists who came together on their own and decided they were not happy with a ruling from last year, and they wanted to come out with their own recommendations. So they came out with some very broad criteria on who they think should be screened, get a full body screen annually for skin cancer, for melanoma in particular. And these are people, this is by primary care pediatricians, not dermatologists.
Okay. And who are the people that they believe should get annual screenings?
So they think anyone between 35 and 75 who, there's some obvious things like family history of melanoma or a previous case of skin cancer. And then some less obvious things like features like blonde hair, red hair, freckles, people with a history of indoor tanning, or people who get a lot of sunburns and blistering.
Right.
People with 40 or more birthmarks, and people with 2 or more atypical birthmarks.
So this is a pretty large group. Dr. Stein, you were not one of the dermatologists who penned this piece, but do you agree with these new recommendations?
Definitely. We know there's people who are at much higher risk for having a skin cancer, and those are just the people that we want to get in for their skin checks.
So tell us because I know a lot of people have never had a full body scan, what does this procedure entail exactly?
Very easy. You go into the doctor's office, and all it involves is looking at all of your skin, what the doctor's looking for with the naked eye or sometimes with special magnification device. They're just looking for a spot that looks like it could be a skin cancer. It's a very quick exam, it's completely painless, and it's done right in the office.
And Sumathi, of course, please remind us of the dangers of melanoma. It is one of the more lethal cancers, correct?
Yeah, so it is the most deadly skin cancer. It's about 5th or 7th most common in terms of invasive cancers, depending on the gender. And the key, I guess, that the kind of message everyone always gives is that it's one of the few cancers you can pick up early. And so obviously you pick it up earlier before it spreads, you have a much better chance of living.
Now, we know that mammograms and pap smears, for instance, are pretty routinely covered by insurance. Are these full-body melanoma scans covered by insurance?
So that's the question. The USPTC, which sort of sets they are the ones who analyze the harms and benefits of different preventative screenings and rule whether it should be done or not. So here they say there's not enough evidence one way or the other, whereas with mammograms and pap smears there is. So because of that, not all insurance plans are going to cover these types of things.
And Dr. Stein, what do you think about that? I mean, do you see patients of yours who are at risk, who forego the yearly, melanoma full body screen because it's not covered by insurance?
I think most of the time my patients are able to get it covered by insurance, especially if you have a history of melanoma, family history of melanoma, you have funny looking moles. Patients are generally able to get in so we can do those important screening visits.
So they are able to convince their insurance companies to cover them in those cases?
My experience has been people are able to get in, but I think it's important for us to get those recommendations out there for the high-risk patients so that there won't be problems in the future.
Now, some doctors say these recommendations don't go far enough. Do you agree with that, or do you think they're spot on?
I think it's important to get a good first start and get those high-risk patients in. And then once we get that achieved, then we can go for a larger goal. But first, certainly anyone with history of melanoma, funny moles, family history of melanoma, tanning beds, burns easily, those are the people you really want to get into your skin checks.
Absolutely. And it's important, Sumathi, right, to remember that even though we put sunscreen on and maybe we're very careful in the sun, if we have a family history or if we're genetically predisposed, you can get these melanomas without any sun exposure, correct? You can even get them on the bottom of your feet.
And like the doctor said, those people are actually usually covered, because they have that family risk. It's more of sort of these broader, like if you have red hair, or if you have, light skin, are you going to be covered? If you're certainly not by your primary care physician.
Right.
It's also a question of should we make this more widespread? There's parts of the country where there are very few dermatologists, so
Yes.
those people don't really have an option, and their primary care physicians aren't usually doing these screenings.
Right, and whether this will move forward to a national consensus finally over these screenings. All right, Sumathi, Reddy, and Dr. Jennifer Stein, thanks to both of you for being with us.